Dear colleagues, hello everybody. My name is Silke Eichner and I'm working as a GP in a primary healthcare center in a small Austrian city called Enns. We are 7 GPs who are currently working in this center. Some of us are doing this job full-time, some like me part-time. Before everything changed because of Corona, we had approximately 500 to 700 patients per day. Since government decided to do the shutdown, it went down to 300 to 400. We also experienced a different type of working. As we normally are having a face-to-face contact rate of around 80% and a phone contact rate of 20%, it now swept completely the other way around. Most of the time we are receiving phone calls or actively call our patients to handle whatever is needed. For example, currently it is quite easy to do the prescription on phone or to send them in sick leave, as government and insurers now allows us to do this without any physical contact. In pre-corona times, we are quite a big amount of people who got treated from a physiotherapist, a speech therapist or psychotherapist, or got support from the social workers. When Corona started, we had to stop this routine work. Any kind of treatment from our therapists wasn't possible anymore, but we managed to handle quite a lot of things on the phone. Most important for our and our patients' safety was and still is the reduced physical contact as much as possible. We try to avert that people are coming in our practice without contacting us in advance. If necessary, we call them back and decide if an appointment for future examination is needed or not. If there is any sign of infection, even it's just an itchy throat and independent of COVID or not, the patient has to come into a special room through a separate entrance from the rest of the people, our so-called infect ordination. So we are strictly separating patients with infectious or non-infectious illnesses. The infected patient has to come on time to an entrance at the back side of our building when no other people should be present. If there are more than one, they have to wait in a distance of 2 meters or in their car. During the examination, we need to wear protective overalls, glasses and of course masks. Lucky us, we have enough of them. If the patient is not able to come to the primary health care center, there is a special team in our area which is visiting those people at home. By now we had just a few cases of COVID-19 and luckily all of them had only mild symptoms. Getting a corona test for suspicious people is not difficult at all. We as a GP are allowed to decide who should get tested. At the beginning, the biggest issue was the amount of people who should get tested. It was just too much. At the moment, people need to wait maximum of 2 days. We also have drive-ins for corona tests. The way we are working is completely different compared to pre-corona times. I, for myself, prefer meeting the patient face-to-face while I talk with them or do the examination. But the ongoing situation also taught us another way to work. People are very thankful when we call them. They feel really safe. For me, it is very important not to forget the patients with chronic illness, psychological problems, or even a pain in the back. Everybody should find help during this time.